Which of the following is the most likely cause of this patient's condition? AIS, ovarian failure, PCOS, or primary or secondary hypogonadism? Uh-oh, that's probably one of those. A 29-year-old woman presents to the clinic with complaints of irregular menstrual periods and difficulty conceiving. She reports having only 3 or 4 menstrual cycles per year, and lab results reveal decreased LH and FSH. Which of the following is the most likely cause of this patient's condition? Let's go ahead and get rid of AIS then, because we know in AIS we have increased LH. When I think of ovarian failure, I don't think of a lot. So I'm going to hold off for that for now. PCOS is usually these complaints in a young obese woman, and I would consider 29 young for sure. Complaints of irregular menstrual periods and difficulty conceiving. They usually always bring up weight,
Okay.
and they don't hear, which it doesn't discount PCOS, but I'm leaning towards that actually, just because it's like irregular menstrual cycles, difficulty conceiving. I don't know. I'm leaning towards that.
Okay.
Primary hypogonadism or secondary hypogonadism. So if you have primary, it's an issue with the gonads themselves and not producing anything.
Okay. Good.
And I guess that the thing is they give us FSH and LH, which are pituitary hormones.
Okay.
So if those are decreased, that means that there's probably too much of something else already in the blood. But I feel like they'd be increased if they, because if they don't have any like of the syndromes, I mean, any of the hormones or whatever that are required for LH and FSH secretion or whatever, then it would be okay. It would be increased. So I'm gonna say, okay, I'm just talking in my head. Sorry.
You're good.
Um,
You're good. What's your gut answer choice?
my good answer is PCOS, and I don't know. I am very bad at repro still. So yeah.
Okay. Final answer.
Yes.
Okay, it's going to be secondary hypogonadism. Okay, so let's talk about that. So PCOS, actually, I'm pretty sure. I think that the LH to FSH ratio is like I think 2 to 1 or 3 to 1 or something like that. So it's going to be elevated. Your
Mm,
LH is going to be elevated, and the way I remember that is, what does PCOS stand for? Is polycystic ovarian syndrome, right?
yes.
So you have a lot of cysts in your ovary, and why do those cysts happen? Is it normal for females to sometimes have cysts? Yes or no?
I guess it could be normal.
Yeah, could be. I mean, a lot of females do have some cysts sometimes, right? And that's kind of the normal cycle because it's kind of like your body is preparing to drop an egg and it goes through a cycle. And so your ovaries will have, the corpus luteum and all that random stuff, right? I can't remember all the exact names of it, but that's how the cysts happen. So the way that you ovulate is that if your LH and F, you have an LH surge to ovulate, right? And so people with PCOS are like stuck in this like consistent like quote unquote ovulation stage is how I remember it, which is why you got a lot of cysts. Does it make
Okay.
sense? And
Okay.
so that's one thing to remember. Number two is like you said, PCOS. I'm pretty sure there's some guideline that you have to have like 2 out of the 3 things to be qualified as being diagnosed with PCOS. So I think it's like irregular menstruals, and then you also have to have like either hirsutism or an ultrasound showing that you have cysts. Right. So here, you only have one thing, which is irregular menstrual periods. You don't have too much else. Also on top of that, right? So ovarian failure is like you're hitting menopause early, right? And if I have to remember the age, there's an age. I think it's before 40 years old.
That's right. You're right. You'd have like hot flashes, night sweats, all these
Yep.
things that are happening in like a 20-year-old person.
Yep,
If that's
exactly.
the
So now
reference.
ovarian failure doesn't fit too much here. And LH and FSH with someone with menopause is off the roof, right? It's because that your ovaries are not creating estrogen anymore. And so your body is going to have high levels of LH and FSH to try to produce, estrogen, but obviously your ovaries are kind of like shut down when you hit menopause, right? So that can be the answer. And then, androgen insensitivity syndrome, as we already know, your LH is going to be super high. Then you have primary versus secondary. So I think you worked through this. You were close. Very, very, very close. So primary is like in a female, it's going to be your ovaries don't work, correct? So if you have
Same thing as
primary,
almost as ovarian failure.
yep. So primary hypogonadism is the gonads, aka ovaries for female not working. So you would expect your LH to FSH to be extraordinarily high. Does it make sense? So that can
Okay.
be right. Then when you talk about secondary hypogonadism, right? That means that your pituitary is not creating enough hormones, which is why why in this case why your estrogen is not being produced. So the best answer here is going to be E, because it's the only
Yeah,
one that will have decreased LH and FSH. And I
that
think,
makes complete sense,
yeah,
honestly.
you're really, really close. I think you kind of mixed it up at the very last second there,
You
right?
were like, no.
Yeah, you're close, close, close. So does it kind of make sense, kind of how we walk through that?
Another thing that I do remember, yes, I remember I did look at this, I think like last week before orientation, and I remember that being a thing that I learned, like, oh yeah, ovarian failure, you would have like a young person with signs of menopause. And I was like,
Yep,
that's very easy to remember. Like, okay, cool. PCOS also they would probably talk about like, oh, by the way, they have like hirsutism symptoms, like symptoms of like facial hair in male places. And then you're right, primary hypogonadism would be an issue with the um ovaries themselves, and so the pituitary would be blasting out LH and FSH, and
bingo.
yeah, everything. Okay, that makes perfect sense. That's good for.
Yep. So I think you're, like I said, you're very close to all these questions, right? And every question that we've done so far. So just a little bit of touch up here and there, right? So
Yep.